Hi, welcome back to my channel. Today I'm going to tell you all about all of the tips and tricks that I have kind of learned from having a C-section. Now, if you've watched my labour and delivery story, you'll know that I had an unexpected C-section. It wasn't classed as an emergency. It was elective, although I had no other choice but to have it. But yeah, so basically you can go and look at that video if you want to know more about that. But basically I never done any research into C-sections, recovery, and that was the first question I actually asked, was what will the recovery be like? And I was handed a leaflet in the hospital to read, and that was kind of it. I didn't really have much time to kind of look up on YouTube or anything about C-sections, what's involved on the recovery. The recovery was the thing I was probably, I wouldn't say I was worried, but it was the thing that I didn't look forward to. It wasn't so much giving birth, but that, which I think a lot of people probably are most worried about. But yeah, my thing was the recovery, because I do like to kind of be up and about. And yes, I am waffling, so I will just get into it. Okay, the first thing I would say is stay on top of your medication. Now, I was prescribed diclofenac and paracetamol, and I took it religiously up until, maybe about, took it all of the first week anyway. Now, I feel like I recovered pretty quickly, but I always kept them anyway. Even when I stopped my pain medication, I still kept them on me just in case, because you never know that it actually might be working and hiding pain, and you don't know, and you think you're fine and you're not. So even though I did stop, I always kept them on me in the changing bag or whatever I was out and about. The other thing I did take was arnica. Now, arnica it's sort of like a more natural sort of, I don't know if it's herbal, I don't know, but basically it helps with bruising. So obviously I would have had a lot of healing to do, internal and external. So I took arnica tablets for probably the first, I would say, month. I took them pretty much every day. I would probably forget, but yeah, I think for a few weeks, a couple of weeks anyway. Yes, so that's what I took. You also have to watch, obviously you have a big wound. Now, I didn't look up, I know you get like special like underwear and things for C-sections, but I obviously didn't have that because I expected to have a natural birth. So I just used what I bought. So I basically just went to Primark and got the comfiest sort of knickers that I could find, more high-waisted, which I think I would recommend. I got two different sets of underwear. One was high-waisted and the other one was just very, very soft. They were like the seamless knickers, so you know, they didn't have like anything, any elastic or anything digging in. So I would go seamless or go high-waisted for your pants. What I would also say is buy comfy clothes for after you've had the baby. I kind of lived in leggings for the first, I did get into my normal jeans pretty quickly afterwards, but so I did wear them now and again, but most of the time I kind of lived in leggings for the first couple of weeks anyway, just because they wouldn't, your scar is usually, well mine is very, very low. It's like underneath my pant line, so, but I still wanted something that was maybe a bit higher waisted and comfy. Obviously leggings are really thin and it feels like you're just wearing pyjamas pretty much, so I kind of lived in leggings for the first little while and it was just fine. No one was really judging what I was wearing. I just had a baby, so it's fine. You want to be comfy. The other thing you are going to need, but I think this is kind of standard regardless of what type of birth you have, but you just need to make sure you have some sanitary pads in the house. My bleeding was pretty light, to be quite honest, because I think it was because I had a C-section. I don't know if it is, I'm not sure. I lost a lot of blood during like the operation, but afterwards like I didn't, if you know what I mean. So but you do need some sanitary pads, so make sure you get them. I had a bandage and it was like a clear plastic sort of bandage. I don't know if it was like silicone, I don't know what it was, but it's basically like a big plaster that was over my scar, and they told me to keep it on. I could take it off after, how many days was it? I think it was it after about 5 days or something, but I kept it on for a week because it was clean, and I would rather my scar was healed up pretty well before I took it off, because obviously you can get an infection after having the operation, and I'm glad I did that. I don't know if it, I just didn't get an infection and I healed pretty quickly, so I don't know if it is due to that. But I speak to your midwife anyway, or your health visitor, and ask their opinion or whatever. I am just telling you what I done. I am not, you can do it if you want, but I would speak to your health visitor or midwife first before you do any of the things I'm speaking about in this video. But this is just what I done and I had a good experience. So so I kept that off. I kept that on for the first week, and then I washed it off in the shower because it's very, very sticky. So I kind of like peeled off. It was quite hard to come off, to be honest. It wasn't sore to come off because it's not sticking on your scar, so don't be scared. It's just sticking on your skin, so it isn't sore, it's just very sticky. So I done it in the shower, and then I used one of those like soft like scrubber things, shower scrubs, to kind of take off the plastic bits because there was stuff still stuck to my skin when I took it off. And then in the shower since then, I always wash it as usual. I won't directly put my shower gel on, well I could now because it's healed, but for the first month or two I would say I just, you know, loaded up my sponge, my shower scrub thing, with shower gel as I normally would, and then wash the scar as well. But I didn't have a bath. I always just had showers for the first wee while anyway, until my scar had healed. I feel like I'm totally waffling in this video. I'm very sorry if I am, but it's 10 to 9. It's quite early. It's not that late, but yeah, I have a baby, so I am quite tired. Okay, so once my scar had healed, I started using silicone gel. Now this is the one that I have been using. It's by Nodasil, I hope I'm saying that right. Nodasil MD, and it's just a silicone gel that I put a thin layer over my scar once it had healed, and I use this morning and evening. Some mornings I do forget, but I definitely use it every night. And my scar, now I am coming up to 4 months postpartum now, and my scar is colourless apart from a tiny bit at this side of it, I think, that is slightly red still, but it's fading fast. So I would say that it's probably going to fade completely too. And that is all I've put on it. I think you can use like bio oil. I have used it a couple of times because I had some left over from when I was pregnant, but I've just kind of stuck to the silicone gel, and that's really worked for me. To help tighten your skin, again, I would avoid putting anything really on your tummy until your scar has healed, but yeah, this is what I have been using. It's just the Nip and Fab tummy fix, and my tummy is pretty much back to normal. You know, it's not like saggy loose skin that I thought I would have after having a baby, but sometimes it's genetics, but I think this stuff is magic and I would use this the next time I have a baby too. So yeah, it just kind of like firms up your skin, I suppose, to help it go back to normal again. Now, final few things. Ask for help. I love to do everything myself, but my husband was there every night and he would help get Mila out of her cot or her Moses basket and things, and kind of pass her to me, especially in the very beginning. You are allowed to lift anything that is no heavier than your baby, so you are allowed to obviously lift your baby, you know, you have to care for it. So I was fine lifting her, but I would always kind of listen to my body. So there was a couple of times where I felt like, oh, okay, no, I have to watch, and then I got someone to pass her to me or get her out of her cot or Moses basket even. If you're breastfeeding, you can also get one of those like breastfeeding pillows, just something similar to this, and this basically goes round your waist and your baby would sit on top of it here and breastfeed, just to kind of save you having to like lift your baby up. So that is something you can also get, which I used religiously in the first probably month or so after having Mila. It really helped. It also helps when you're kind of learning how to breastfeed. It kind of supports the baby a bit more. Use your arms, not your abs. I learned pretty quickly that I couldn't use like my abs to kind of, you know, when you're sitting up to get out of bed and things like that. Always use your hands and your arms to kind of push yourself up. Because there was a couple of times where I forgot and then I was like, okay, it's a bit sore. But there is a myth though. Some people think that, you know, when you get a C-section they cut your muscles. They don't. So you know, your scar is very low down, so if you think your abs are not anywhere near that, so they don't cut into your muscles, but still like your scar is there. So yeah, just watch what you're doing there. Just always kind of use your arms to kind of like pull yourself up and things like that. As I've said, no lifting anything heavier than your baby. Get everyone else to do any heavy lifting that needs to be done. Hoovering and things like that shouldn't really be done the first wee while anyway. I think after the first month I was probably back to it. Maybe even, I think I did put it in one of my updates. But yeah, just try and get people to do the heavy lifting or any sort of chores like hoovering for you. No exercise. I would say the first 6 weeks I wouldn't really do any exercise apart from really walking. I did do walking and I had a few people like speak to me. I posted a picture, I think it was like 2 or 3 days postpartum, and I had a few people kind of say, what, like, are you mental? But it was only like around the corner and things. I wasn't going like big long walks after I'd had her because I knew I couldn't do it. Like, you've got to listen to your body. But I would say no intensive exercise. I would just, if you want to exercise, I would just do light walks up until you're about 6 weeks postpartum. And yeah, like I said, listen to your body. That is the indicator of how things are going. Please don't push yourself too much. I think people are thinking, oh my goodness, like I feel amazing, and you are on a high after you've had a baby. But really just listen to your body and don't push yourself, because if you do push yourself, your recovery is just going to go back the way. And you don't want that, and then you can risk things like infections, because you have to realise that you're healing from the inside as well. You know, they've cut through lots of layers, so there is a lot of healing, and maybe you do think, oh, look at my scar, like it's healed up. Inside it probably hasn't, and if you start exercising, you're pulling away the tissue again, and it's not very nice. and then you can do yourself a lot of damage. And it's not going to be long until you are able to do the things you want to do again, you know, if you want to do like HIIT training or whatever, but just like enjoy your little newborn bubble. And I really did, and it passes in a flash. Like, I can't believe we're like 4 months in already. But yeah, really just listen to your body and don't push yourself. So that is all the tips and tricks that I have learned on how to kind of like recover after having a C-section. I didn't have a clue. I wouldn't have been able to tell you any of this prior to having Mila, but yeah, now I've had a C-section, I know what I would have to do. If I would do exactly the same basically if I was to have another C-section the next time. So I hope you've enjoyed listening to this video. Leave any tips or tricks that you've got for C-section recovery or a natural recovery in the comments below, because it's nice for other people to kind of, you know, get advice. I like looking at comments and other videos that I watch as well, just to kind of see what other people's perspectives are, because you might not agree with some of the things that I have done, but I know I do exactly the same the next time. But please do make sure that you're speaking to your health visitor or midwife if you do want to do any of the things that I've done, because they might not advise you to do it. You know, everyone's experiences are different and everyone heals differently and has different births. So yeah, make sure you speak to them. So thanks very much for watching this video. Give it a like if you've enjoyed it, and I'll speak to you next time.